Thank you very much for the invitation to be here today. It was difficult for me to put together this presentation. I'm still very much learning the context in the UK. It's fascinating to me as one who's followed food banking for a long time, but I realize in constructing this presentation that I'm making assumptions about what's going on here and about what you might find interesting about what's been going on in Canada. And we'll see just how correct they are. So what I'm going to try to do is take you through a bit of our history of food banking and then onto our history of monitoring and where those two things have come together and where they have collided and where I think we're at right now. The dominant image of food insecurity in Canada is still this one. This picture is something you could see on trucks in Toronto every day. It's obviously a photograph of an appeal for donations to the food bank in Toronto. These kinds of images are all over the place, and they very much, to this day, define the problem and sadly define its solution. Martin mentioned the expansion of food banks in Britain. In Canada, our history dates back to 1981. Through the 80s, we saw a very, very rapid proliferation of food banks. And this is just a little bit of the cataloging of the numbers. But there was a point in the 90s where a politician in Canada was quoted famously as saying we had more food banks than McDonald's. I don't know now which one we have more of. The most recent number we have is from the 2015 Food Banks Canada report that was released in November. And at that point, they were surveying more than 4,000 institutions. What's also become clear to us, though, in our research is that these numbers don't mean anything. That the reason the numbers didn't get bigger faster is because we started to see consolidation. And what is a food bank and how a food bank is defined is a very nebulous concept. This is the basic structure of food banks in Canada as they began. And I offer it to you because there's an awful lot of conversation happening, I think, in Europe and the United Kingdom, and certainly in Canada, about the intersection between food insecurity or hunger and food waste, and the importance of retrieving all this waste of food to feed to hungry people. You know, it's an equation that we hear, an equation of ideas that we hear all the time. Well, in fact, the very design of food banks in Canada from the inception of them in 1981 was this idea of taking waste, taking food that could not be retailed for a variety of reasons and recycling it as food assistance for poor people. So we started with major food distribution organizations who were primarily supplied by food producers, food processors, food retailers who had product that for a variety of reasons they couldn't sell. So that was the start. We also, in no time, saw corporations doing fundraising campaigns for dollars because it became quickly apparent you can't have a food bank without some funding because there are needs for things besides food, right? You need facilities, you need transportation, you need other things. So it started with those kinds of donations from the corporate sector. On top of that, people canvassed their local retailers and local grocers for leftovers again, and we saw what has sadly become a fixture in Canadian society, food drives. The organized appeal for donations that happens from a church or a school or a social club of some sort, a union, all kinds of organizations collecting food or collecting money for their local food bank. What we've also come to realize is that there's a whole bunch of other charitable food providers that are outside this net of the centralized food bank operations. The statistics I'm showing you at the bottom are ones that came from a study we did a couple of years ago of interviewing 535 charitable food providers in 5 large Canadian cities. And we estimate that maybe 2 out of every 3 food charity organizations in Canada are actually a part of this bigger food bank net. But in fact, there's an enormous amount of activity going on that's under the radar. Anybody can start a small food charity activity, and in fact, that's what's happened. And they can give out food once a week or once a month, whatever they feel like, whatever works for them. And mostly it is sustained through donations from community sources, but also from local retailers. The role of government in food banks in Canada is primarily facilitative. Food banks do not receive government funding as such. They're not managed by governments. They're not in any way accountable, or governments are not accountable for them in any direct form. In the 1990s, we had provinces introducing, a series of provinces introducing what's called Good Samaritan legislations. This is a law patterned after laws in the United States that absolves corporations of liability for the health and safety of the food that they donate to food banks. So the initial foray of government into food banking was to pass those legislations. What came after that then were some little spotty funding of activities to create guidance documents to help food bank volunteers manage that food supply. Because obviously this is a food supply that's outside the net of health and safety standards in Canada. So most recently, if you're interested in this, we have a fascinating document. It continues to this day, the need to produce documents to help volunteers in food banks manage that food supply. A huge document has just come out from a group in British Columbia that's more than 100 pages long, telling people how to make sense out of food and decide when the food is safe for distribution. We've also seen small investments in infrastructure, most notably in the province of Quebec. And most recently in Ontario, the passage of legislation to provide tax credits to producers, to growers, for the donation of their food to food charities. But we're still just on the cusp of actually giving tax credits for food donations or for corporate donations. But the picture overall here is one of passive support and enabling of food bank operations. So I want to talk more directly about the measurement and the sort of the public face of food banks from that perspective. So I said the first food bank appeared in 1981. In 1987, a national association was formed. And in 1989, there was a survey, the first attempt to compile statistics on food bank activities in Canada. That survey was a massive undertaking, and it was released under the title Hunger Count. That this was a count of hunger in Canada. In 1997, the system of hunger counting came back into effect, and we started to see the annual release of hunger counts. And they continue to be a very, very important public measure of this problem. Here you see the one from 2015. It just came out in November, and this is the kind of thing that it reports. How many Canadians were served during the month of March by Food Banks Canada's members. Here are the sum total of their efforts. What you can see is that in a year since the late 90s, our number of Canadians being helped by food banks, according to these statistics, ranges somewhere between 700,000 and 800,000. Okay, so what about food bank measurement? Because we were much, much slower to come to into the act. In 1994, someone put a question on the National Longitudinal Survey of Children and Youth that asked people if their children had ever gone hungry because of a lack of food or money for food. It was just a very simple little question. And then there was another question after that that said, and if they did, what did you do about it? And you had some options, and one of them was seeking charity. But that was the beginning of measurement in Canada. One question basically asking about child hunger, probably the most extreme manifestation of food insecurity. That question was introduced because it was recognized by the 90s that we desperately needed to understand this phenomenon of food banks and these food bank numbers that were being reported. After that, we had an embarrassing assortment of indicator questions appearing on national surveys, and I can speak more about this later. Never the same set of questions twice, but always a little mix, just something small, something that could be answered in a couple of seconds, asking about someone's experience of food insecurity. But again, it reflected a deep desire to understand better what was going on. It wasn't until 2005 that monitoring began in any serious way. And by then you can see we were well after the annual release of hunger counts. The questionnaire that we use to monitor food insecurity in Canada is one that we've taken from the United States. It's an 18-item module that basically is measuring inadequate or insecure access to food due to financial constraints. The questions range in severity from people worrying about running out of food because of a lack of food or money for food, on through to not being able to feed yourself or your children balanced meals, and then a whole string of questions that are trapping varying degrees of quantitative compromise. So skipping meals, cutting meals, going without eating, and at its most extreme, going whole days without eating. Always the questions have a clause attached to them to anchor the experience in financial constraint, so that what we're trying very hard to do is capture involuntary food deprivation or involuntary food compromise. The questions differentiate between the experiences of adults and children because of a heartbreakingly large body of literature showing that when families are pressed, parents will deprive themselves of food as a way to free up food for younger children in the household. Sadly, increasingly there is literature suggesting that teenagers do the same thing. So what does it look like? Our most recent national estimate is from 2012, and that year 1.7 million Canadian households responded affirmatively to at least one of those 18 questions. And that translates into about 4 million Canadians, including 1 in 6 children. The bars to your right here are showing you the 4 years for which we have comprehensive national data, and what you can see is a steady rise. We've broken the numbers, the bars down. One of the things that this 18-item module enables us to do is scale out the severity of the deprivation. So we're moving here from people who've affirmed probably only one item on that questionnaire, most likely the question about worrying, through to people who affirm more items suggesting that their household was at least compromising quality, if not sometimes compromising quantity, and then at the most extreme level, people who said yes to enough of these questions that we have reason to believe that adults and possibly also children in households actually didn't eat at times or ate way less than they wanted to because of a lack of food and money for food. Here are the numbers in a different representation. So, as I said earlier, we have a significant increase over the period that we've been measuring nationally. The increase in the number of Canadians living in food insecure households has risen by more than 600,000 between 2007 and 2012. How does that compare to food bank numbers? Well, I think this says it all. These are the numbers from Food Banks Canada of the number of people that they served in each of these years. And what you can see is that we're off by almost a factor of 5 here. This is consistent with more direct measures of food insecurity and food charity in Canada. The most extensive work in this area has been by Rachel Loopstra. And what we figured out is that most people in Canada who are food insecure don't seek charity. They don't use food banks. Why not? Largely because they don't perceive food charity as a solution to their problems. They don't define their problems necessarily as problems that require them to seek charity. They don't think that their problems will be solved by this request for charity. But the other part of this is the arbitrary nature of food charity distribution in Canada. It means that there are many very real barriers to access. And I can speak more about that later. I haven't made it a big part of this talk as it stands right now because most people are sitting in this category, not that one. What does it mean in terms of measurement and monitoring food insecurity? Food bank users represent a small and non-representative subset of the bigger problem. And changes in food bank numbers do not track changes in food insecurity at the national or the provincial level. So it's a very, very dangerous thing to be pitting all of our understanding of this problem on this service provision. I'll speak now briefly about what we have come to understand about the problem based on the measurement and monitoring that we've done. And the most important thing, I think, is this. As you'd expect, people who say yes to those awful food insecurity questions are people who typically lack money. Because the way most Canadians get food is to buy it, to be without food is to lack money to buy food. So as household income decreases, the probability of a household reporting food insecurity rises. But what you must already be noticing from this picture, if you understand at all what you're looking at, is that it's an imperfect relationship. What I'm showing you here is the prevalence of food insecurity by different groups in Canada based on household income. The household income has been adjusted for household size to make this a comparable graph. But what is striking here is that even at the very lowest levels of income that we capture, fewer than half of households report food insecurity at any level on that scale. As we get to the higher levels of income, the probability of reporting food insecurity diminishes, but still it never reaches zero. This disconnect between food insecurity and income is one that's been observed repeatedly when people have measured this phenomenon, both in Canada and the United States. And some have argued that it means that the measurement is no good, and that we understand income as a social determinant of health, we understand poverty, we understand how to measure it, we spend a lot of time on that. What are we gaining with food insecurity measurement because it doesn't even map income properly? That's a continual battle for us, but it's over the time that I've been working in this area, and as you can see, I've been working in this area for a long time, I've come to believe that the reason food insecurity doesn't map income very well is because food insecurity is actually a much more sensitive measure of material deprivation than income is. By the time somebody is struggling to put food on the table because of a lack of money, what we're seeing is the product of household income and assets and savings and access to credit and household expenditures, chief among them being housing, but also debt. So at the point that we're capturing someone as vulnerable based on their household food insecurity as measured by this 18-item scale, we know a lot about the level of resources in that household and the extent to which that household is functioning. Only one part of that is whatever they reported as their annual income. But there's a whole cascade of other things going on that put pressure on the availability of resources for food. And it's this other understanding of food insecurity that I think is, if I can offer you anything today, this for me is the most important one. What we're trapping is a measure of very, very significant material deprivation. And it doesn't map with income for good reason, because it's actually a complex of a whole bunch of things, income being only one of them. That means, though, that it is giving us something different than classic measures of poverty. To illustrate that, I'm showing you here the relationship between food insecurity and household income expressed now as a ratio of the low income measure. In Canada, the low income measure would be seen as the socially progressive measure of poverty in our country. And so everyone's income here has been made as a ratio, so those below one would be considered poor based on the low income measure. And as you can see, for sure, the probability of food insecurity and the severity of food insecurity rises with very low incomes, but the relationship is imperfect. So to not measure food insecurity and to just be working with the proportion of households below the low income measure would be to get a different picture than to be looking at food insecurity. Looking at household food insecurity in relationship to income source has also proven to be very instructive. What I'm showing you here is also from the 2012 Canadian Community Health Survey. And this is the prevalence of food insecurity by household, across households, based on the main source of income in the household. And what you can see at the very bottom end are seniors. Households that reported a reliance on pensions or retirement incomes have the lowest prevalence of food insecurity in our country, much, much lower than everybody else. Even lower than those who are in the workforce. At the other end of the spectrum are people on social assistance, primarily welfare, and there you can see that to be on social assistance is almost to be guaranteed to be food insecure. It's 70% nationally. In some parts of the country, it actually rises to 80%. But this has been instructive because it's the beginning of us being able to chart and to talk about the social policy underpinnings of this problem. Our colleagues in Alberta at the University of Calgary have done a lot of work to look at the low rates of food insecurity amongst seniors. And what we've seen, or how we've come to interpret those findings, is that Our low rate of food insecurity amongst Canadian seniors speaks to the success of extensive poverty reduction efforts that went on through the 90s and through 2000s in Canada to lower the rate of poverty amongst seniors. There was a lot of work done, and indeed it was successful. The rate of poverty amongst Canadian seniors has fallen a lot in the last 15 or 20 years. The center point of the interventions was a guaranteed annual income indexed to inflation. When someone turns 65 in Canada, if they were on welfare before, when they turn 65, their income will more than double. That's how much better the income support is for people on seniors' pensions. On top of that, they will be indexed to inflation, and most of the other benefits in Canada are not. In addition, with seniors, we have a huge outpouring of support from the private sector. So I don't know if this happens in Britain, but there are seniors' days where you can go to the store and everything in the store you can get a 20% discount on. You can get a discount on public transit. You can get a discount on train travel. You can get all kinds of, and you will have pharmacare. We do not have universal prescription drug coverage in Canada, but we do for seniors. So turning 65 for very low-income Canadians is sufficient. Just having that birthday is sufficient to drop the risk of food insecurity in half. Okay, another thing that we've started to be able to do from looking at the monitoring data is see the effects of changes in public policy. And I'm going to give you one illustration just to show how sensitive this measure of food insecurity actually is to policy intervention. What I'm showing you here is the accumulated data on food insecurity in Canada with this 18-item module, and since 2005, and by province and territory. So I don't know how much you know about Canada. As I looked at this slide yesterday, I thought, I bet they won't know anything about those abbreviations on the bottom. It doesn't matter. Don't worry about it. It doesn't matter. I contemplated writing the full names, but yeah, as you can see, they wouldn't have fit. So here's what we were going to try to do. Just look at the bars. And sometimes a bar is missing, like here, right? And that's the province of New Brunswick. And occasionally the food security module is optional and provinces opt out of it. They don't even choose to measure food insecurity, and that's what happened here. Okay, you can see this big mess over at this end. This is Canada's north. These are the three territories. And this is a little tiny place called Nunavut. The prevalence of food insecurity in Nunavut is sitting around 45%. About 2/3 of children in Nunavut are food insecure. And this is just a little small geographic area in the north. But even in central and western Canada, we never have a rate that's falling below 10% here. The other thing, though, is that most of these bars are not different than the other. There's actually only one situation here, and that's Newfoundland and Labrador, where we've seen a significant decrease in food insecurity over the period that we've been measuring. So most of this is just random perturbation, even though almost every one of these jurisdictions has introduced some kind of a poverty reduction strategy or something to ostensibly help lesser advantaged members of their province. Let's take a closer look at Newfoundland and Labrador. The drop in Newfoundland and Labrador is absolutely unprecedented. We only noticed it when we started compiling routine statistics on food insecurity in our country. Nobody knew this was happening. But between 2007 and 2011, that province dropped by 5%. This was a period in the beginning, at least, of an economic boom in Newfoundland and Labrador. They're at the far east of our country, and they had an oil boom. They have offshore oil, and at that time it was worth something. And so they were doing very well. And so there was a change in their economy during this period. But the other thing that happened during this period is Newfoundland and Labrador introduced a poverty reduction strategy. And it was unlike all the others. It was a strategy that was designed to turn Newfoundland from a province of have-nots to a province of haves. And so it was tackling both the breadth and the depth of poverty in that country. They weren't, in that province rather, they weren't focused on food insecurity at all. They didn't even, I'm sure didn't even know what the term meant, even though it just happened to be being measured in the background on this survey. So this is me speaking drawing heavily on Rachel Loopster's work, but she did a lot of work to try to figure out what was behind this drop. And one of the things she figured out is that when we decompose these bars, a big part of the change had been what happened to people on income support. That's people on social assistance in Newfoundland and Labrador. 44% of the overall drop between 2007 and 2011 could be accounted for by the drop in food insecurity amongst people on social assistance. Shown another way, here's the rate of food insecurity amongst households in Newfoundland and Labrador who reported receiving income assistance from the province. It fell from about 60% in 2007 through to about 34% in 2012. Now, all of these households would be poor by any definition of the term. And even now, in 2012, they would be considered poor. All of their incomes would be well below that low-income measure I showed you a while ago. But what has changed is their ability to feed themselves and their children. How come? Not because there was an institution of a bunch of food programs, but because the material circumstances for people on income support in Newfoundland and Labrador were improved in a whole bunch of ways. The income benefits were raised, they were indexed to inflation, there were changes made to expand the pool of affordable housing, healthcare benefits were extended, there were a whole range of initiatives. We're never going to figure out which one of them was the lever. But what we can see is that food insecurity, amongst this group that are extremely high risk, food insecurity has turned out to be very, very sensitive to this intervention, right? So much so that we can track this kind of a change and we can see it paying off in terms of the provincial policy or the provincial prevalence estimate. I offer it to you as an illustration of the value of monitoring and what we're getting out of it in terms of understanding the relationship between public policy and food insecurity in our country. What about the implications for health? Well, because food insecurity has been monitored on health care or population health surveys since we started measuring it, we actually have an enormous amount of data on the relationship between food insecurity and health. And I'll just show you a couple of things. First, that question that got added in 1994, has your child ever gone hungry, has turned out to be a gold mine because that was a longitudinal survey. Practically nobody said their children had gone hungry, but those who did, when we look at those children 10 and 15 years later, they're very, very different than other children. They're more likely now to have been diagnosed with a whole range of chronic conditions, including things like asthma and depression. The relationship between those children who are now young adults, the relationship between their health and their history of exposure to hunger, or what we would call now severe food insecurity, those associations are independent of income, of education, of maternal health status, of baseline health status of the child. They're independent of all kinds of things. What we're picking up here is, or at least we think what we're picking up, is the direct effect of severe food insecurity on the long-term health of Canadian children, and it's very negative. We also have a whole lot of data on adults, although nothing as nice as the longitudinal data from that National Longitudinal Survey of Children and Youth. What I'm showing you here are the associations between household food security status, divided into these categories of severity, and an adult having been reported having been diagnosed with these various chronic conditions. So let me just orient you to this slide by picking one of them. Let's take this one, mood and anxiety disorders. So this would be somebody who said, when asked on a cross-sectional questionnaire, had they ever been diagnosed with a mood or an anxiety disorder by a physician and a condition that was expected to last for at least 6 months. And these are people who said yes. What you can see is the probability of someone having reported a diagnosis of mood or anxiety disorders moves in a stepwise fashion in relationship to the severity of their household food insecurity over the 12-month window for which it's been measured. So that the most severe, people in the most severely food insecure households have a much, much higher probability, or those adults, of having reported a diagnosis of mood or anxiety disorders. In fact, in Canada, almost 50% of adult women living in severely food insecure households have been diagnosed with a mood or anxiety disorder. The association is profound. But this pattern persists all over the place, right? You can see it for conditions that we would think about as diet-related, like diabetes. or maybe hypertension. But it's not as neat for hypertension, but it's across a broad spectrum of conditions. This and other pieces of evidence associating food insecurity with health have left us thinking that this is way, way more. The effects of food insecurity on health go way beyond nutrition. That I think the early research in Canada and in the United States, we were all looking for biological pathways that associated with dietary compromises associated with low incomes. And we assumed that what we would see is a pathway leading to something like adult onset diabetes. I'm sure that pathway exists somewhere out there, but pictures like this really challenge the notion that what we're talking about is primarily a dietary perturbation. The extent of material deprivation is broad and its effects on health are broad. More recently, we've been able to look at the healthcare costs associated with food insecurity. Over the years that food insecurity has been measured using that 18-item module, in Ontario, which is Canada's largest province, about a third of the population of Canada lives in Ontario. And in Ontario, we have a unique ability to link the survey data that includes that measure of food insecurity with health administrative data. So for this picture is based on almost 70,000 adults' data. We've pooled data over several years. And so what you're seeing is a 12-month period when the adult responded to the Canadian Community Health Survey and answered that 18-item module telling us, so we have a measure of their household food security status, and that has been linked then to their healthcare utilization over that same 12-month period. The healthcare utilization is captured in a variety of ways because this is administrative data. So here you see the capture. People on social assistance would be eligible for prescription drugs in Ontario, so that's the pale blue. Home care services, same-day surgeries, hospitalizations, physician services, so that would be somebody going to see their family doctor probably, emergency department visits, and then a variety of other conditions. Every single one of these categories of spending, except this other, shows a highly significant association with severity of food insecurity. The more severe the household food insecurity, the greater the cost of healthcare that was spent on that individual over that year. So the dollars and figures that you're seeing here are per capita averages. So this is the average cost per adult, 18 to 64. We're only working with working aged adults here. The average healthcare cost per adult in a severely food insecure household in Ontario over a 12-month period for which we've measured. And you can see that it is more than double the cost of somebody in a food secure situation. We have done more elaborate analyses, adjusting for potentially confounding factors. So taking into account the age and sex of the respondent, the household income, in this case, the data I'm showing you are neighborhood income quintiles, the respondent's education, other variables that we would expect to associate with healthcare utilization. After we do that, we still find highly significant differences in the level of healthcare dollars being spent on adults in Ontario based on the severity of household food insecurity. So much so that still, even after all of our adjustment, we're sitting with people in severely food insecure households costing the province more than double that of food secure Canadians. Oops. Hey, what happened? Okay. I intended to delete this slide, but since it's here, one of the things that I learned in the course of working with this healthcare data stuff is that about 2/3 of healthcare costs are created by 5% of people. That there are what are called this elite group of people, I don't know if you know anyone in this group, but an elite group of people who are what's called high-cost healthcare users, and they absorb a huge amount of the money in the system. So using the same linked data set that I just described, but a different group of researchers in Toronto, looked at what predicted high-cost healthcare use. And what they found was something that they had certainly not anticipated. They were looking at a whole range of sociodemographic factors and neighborhood characteristics, social capital, a whole range of things. Food insecurity trumped them all. An adult in a food insecure situation had a much, much higher probability of becoming a high-cost healthcare user looking for 5 years hence than one who did not report food insecurity. Okay, so here we are in January of 2016. Where have we come to? And this, I have to say, is a rather depressing little slide to have had to make, but I felt it was important to summarize the accomplishments in Canada so far. We've got about a decade of monitoring data. We've got about 3 decades of research on food insecurity in our country. We have an extraordinary volume now of data with which to characterize the magnitude of the problem, the sociodemographic correlates of it, the health correlates of it. We've even now moved to this very sophisticated data linkage project where we are charting the healthcare costs associated with this problem. We're about to look at maternal and infant health and birth outcomes in relationship to health. We have a huge amount of knowledge, and we have the potential for a vast amount more knowledge about this problem. We have clear evidence, I think, and I think probably our best evidence is Newfoundland and Labrador and our seniors, but we have an increasingly, I think, persuasive body of evidence that food insecurity is sensitive to policy changes, both in positive and negative ways. We have yet to see food insecurity be made a public policy priority. And I think that's got something to do with its origins. It continues to be very much seen as a story of food banks. And I think this is a logo that appeared on a food drive a few years ago. It's still the case that the public face of this problem continues to be food charity. And in making that the public face, it also means that becomes the public notion of the solution, right? The solution is in that bag. So that took us in this research group called Proof, that is our current, the name of our current activity. And that took us to thinking about perhaps what we have as a knowledge translation problem. Not the need for more data or the need for more research, but perhaps we have a problem that we have to deal with in terms of knowledge translation. And so a couple of years ago, we started releasing annual reports. While food insecurity has been measured in some way, shape, or form since 1994, the government in Canada, either the federally or provincially, has never popularized those numbers. So people like me who do research were aware of the numbers. We knew how to gain access to the surveys and do other work with them. But we were a very, very elite group, and we were not the norm. Most of the work that was happening in Canada was published in academic journals. It never made its way into the mainstream. And so in 2013, we started a very aggressive knowledge translation activity with these reports, directly targeting the hunger count reports of Food Banks Canada. We were absolutely, they're claiming they're counting hunger, we're counting hunger. We'll show you our counts and put these things out, and we'll describe our demographics. And so that's what we did. And the outpouring has been fascinating. This is just a few of the headlines from what's called a listicle that started being published just before Christmas. Once we started releasing these reports, we were overwhelmed with requests for more information. And the first report that was released, I mean, there would have been more than 100 media hits on that report within probably the first week. We did nothing but media. And the media led to more invitations for talks, more invitations for other sorts of interactions with all sorts of groups, with health professionals, but also with all sorts of civil society organizations. What was clear from the release of our reports is that there was a real hunger for more information about this problem. And many people knew in their gut that the food charity system we had wasn't working, but most people didn't know anything about these other numbers. When the federal election happened this October, we started to see the consolidation of some of the learnings that had happened over really a very short window of 2 years of disseminating these results. What has happened, I think it's fair to say, is that civil society organizations that are working in this field now have come together with one voice on the need to deal with hunger through a public policy response. What used to be a very diffuse set of asks has come together. Actually, a lot has coalesced around the argument for a basic or a minimum income. Through this election, even groups like the Dietitians of Canada, this is their federal election ask. Number one priority is a national strategy to reduce food insecurity. we have not seen this before, right? So I think what we're seeing now is we're reaping some benefit from the knowledge translation strategies we've done. Where we're going to go, I don't know, because sadly at Christmas time we also saw this. You might recognize this man, our new Prime Minister. This is him and his beautiful wife in one of endless photo ops at a food bank in Montreal. This is standard politician photo op material. So we have a ways to go, but we are encouraged by the fact that there is such a huge appetite now that we have started this what began as a very aggressive dissemination strategy, that there's an appetite for learning more about this. And we are hopeful that within the short run, we'll start to see it being taken on as a policy priority. So lastly, I just need to acknowledge that I'm speaking as the royal we here. This absolutely, mostly is not my work. I'm part of a much larger group. Thank you.
Well, thank you. Fascinating but disheartening, if I
Yes.
may say so.
Yeah.
Okay, let's open it up to questions. If you can say who you are and maybe give Valerie a bit of background about why you're asking, if you're coming from a particular organisation or a particular perspective, that would be useful.
Alicia Weston, from Bags of Taste. We work with people in food poverty, teaching them to cook and working on behaviour change around dietary intake. You mentioned that the food bank users were non-representative.
Yes.
Why is that?
Well, sorry. It's not, quite simply, it's not a random sample of people who go to a food bank. The work that we've done in Toronto, at least, would suggest that when people go to a food bank, it's a strategy of desperation. And so they are more likely to be severely food insecure. And I guess the other thing we can say about them is what? It's a strategy of desperation. They're more likely to be severely food insecure. Food banks are seen as a last resort. When we look at the statistics, the social and demographic characteristics of food bank users and compare them to the social and demographic characteristics of food insecure people, what we can see among very striking patterns is that about 2/3 of households in Canada that are food insecure are working. They're in the workforce. They're trying to make ends meet through employment, but they're not managing. And I think it's 16% of food insecure households in Canada are on social assistance. When we look at food bank data, the majority of their clientele are people on social assistance. I think some of what we see in food bank numbers is food banks' understandings of the deserving poor. They create eligibility criteria because demand for their services always exceeds supply. So they have to screen, they have to show that they're donors, that they're giving to the most needy. And so what that filter looks like is about the food bank workers' understandings of need. And because social assistance rates are so low and social assistance recipients are so vulnerable, they have tended to be prioritized. That's not a bad thing, but it's just one more illustration of the I shouldn't say haphazardness, because there is a logic to it, but the disconnect between the services that are provided and the nature of who gets through those doors and the actual users. There's something else I want to draw your attention to with respect to this food bank question, because I think it's important. This. One of the things that we learned in our study of food banks in these 5 cities that we did a couple of years ago is we asked food banks how much outreach they did. How did they let people know of their services? And many of the places that we interviewed didn't do any. They said it was word of mouth, or maybe they had a website. Now, a lot of low-income people can't afford internet or don't have regular access to it, so I don't know how well the website would work. But many of them had very little outreach and possibly none. Many of them didn't even have signs. And some would say, well, that was because they don't want to stigmatize the users, but it also renders the service practically invisible. What they all do, though, is have this stuff. Most of the communications that food banks do is not to the users, it's to the donors. And so the public image of food banks, that everyone has taken up is the image that is presented in the appeals for donations. And this is typical of that image. What's wrong with that picture? Well, people who are food insecure are doing everything they can to prevent their kid from being that kid, right? They will prostitute themselves before they will let their kid go hungry. So the image of food banks that is portrayed in these donation campaigns is often one of an empty bowl or an empty plate or a hungry child. And so it makes sense that a food insecure adult, a parent, would look at those pictures and say, well, that service isn't for me. I'm not that desperate. And in fact, when we interviewed people in Toronto, many of them said that. They don't identify with this service because they're bending over backwards to not have that be their kid. So I think it makes sense that there would be a disconnect, but it speaks to the fact that, I mean, food banks are not an entitlement program. They're, a voluntary charity, and who they get is who comes through the door, and that has to be someone who's very desperate to want to take up that image.
Thank you. Thanks for a brilliant talk. Rebecca O'Connell at Thomas Coram Research Unit at the UCL Institute of Education. It was brilliant to hear you, so thank you for putting on the talk. I've got two questions. The first one is about the relationship between the definition of the measure and the solution, because at the moment we're sort of grappling here in the UK with how we might measure food insecurity, if we might, and so forth, and thinking about how food poverty more broadly defined to include social participation, to include the social acceptability of procuring food and so on, as a sort of broader measure than food insecurity, and whether politically as a measure food insecurity allows a kind of solution that is to give people food, to be fed, not to feed themselves. So there's one set of questions around the kind of politics of measurement. And I also wondered if you could say something more about food insecurity and material deprivation, and whether food insecurity would map neater onto poverty if poverty were not defined by income but by a broader set of material deprivation measures, even though there would be some overlap there with food insecurity being one of those measures, one of those items of deprivation.
Well, to answer your second question first, yes, I think probably food insecurity would map more directly against a broader set of measures of material deprivation. But I think the extreme desperation that is expressed when someone tells us that they are going without eating because they don't have money for food, I think that level of material deprivation has yet to be contemplated even in the measures of material deprivation that I've seen. So I think we are capturing, when you look at our ability to scale by severity and how the scale of severity of food insecurity maps so clearly with health and with other sorts of negative outcomes, I would worry that in talking about material deprivation as it's been, and I'm not an expert in this area at all, but I would worry that in the ways in which material deprivation has been conceived in the existing scales, it hasn't even begun to get to this level of deprivation. To go back to your other question about does the fact that we ask about food in our food insecurity measure, does that set us up for a solution of food assistance? That's your question?
The question is that in some understandings of what it means to food poverty is a broader kind of concept, I suppose, an idea rather than a concept that includes, so in broad definitions of poverty, like a Townsend-Indian definition of poverty, we would expect people to be able to participate in social activities as well as to have particular goods. To be able to participate in food
Yes.
Activities that involve food as a means of social participation. So some people defining food poverty would include being able to have a friend for dinner, a child's friend for dinner, for example, every fortnight. Or some of
send your kid on a school trip with money for a meal.
For a meal. So some of those kind of social activities that are what food is actually about, as well as nutrients. Food, we don't need nutrients, we eat food, and they're very essential to social participation. By defining that out of a definition of food poverty and defining out of it social acceptable means of procurement, so we know it's so shameful to visit a food bank. A lot of the research that's coming out at the moment that we've done ourselves and Rachel has done tells us that it's very shameful, it's undignified, it's not socially acceptable means of procuring food. If we define those out of the definition, do we really hand it to, say, Ian Duncan Smith to give people vouchers for food and say that we're solving a problem? So it's a question around the politics,
I don't think so. I don't think so at all. I mean, I think that the struggle that, if we have a struggle now, I don't even think we do. There would have been a time when I would have said we have a struggle to shift the focus away from food assistance and onto the material deprivation and the income that underpins that. But honestly, I don't feel that way anymore. Even Food Banks Canada, our large and very corporate entity that is the umbrella for all these food bank organizations in Canada, so many of them, even they, when you look at these reports, reports are mostly filled with recommendations for social policy reforms. So I don't think there's anything inherent in the measurement or in the concept that drives us towards charitable food assistance. And it probably is different here than it is for us, but because we live in such close proximity to the United States, and they have publicly funded food assistance programs, we often find ourselves drawn into conversations about that. But it's not, I don't think it's got anything to do with the measurement. It's just, well, wouldn't we be better off with a different kind of program? Well, it's right. So we've actually done some work to look at what it would mean for Canada to adopt a publicly funded food assistance program like the United States, or a publicly funded school feeding program like the US has, but we don't have. What would it mean for us to do that, and what would that do for our food insecurity statistics? Well, the answers to those two questions, I'm sure you can imagine, neither one of them is a sales pitch for the adoption of those programs. They're very, very expensive, and most people in the United States who receive publicly funded food assistance under the SNAP program, most of them are food insecure. So we don't need to stay up nights worrying about that program being the panacea to this. So no, I don't think so. I mean, remember, with our questionnaire has come this huge amount of data for us to be able to draw things like those income curves, or to do things like the study that Rachel did looking at the poverty reduction strategies in Newfoundland and Labrador. We have parallel studies in British Columbia and Ontario now, showing very different results because of the design of their strategies. So I think the measurement has actually made it easier for us to link to very directly to income-related policies. Would we gain by having questions related to things like the social acceptability of food or food procurement activities? I'm not sure that we would. I mean, the gain that you would make would only be if you had an audience that thought that was extremely important and they needed to intervene and put money on the table, because that's ultimately what intervention is here. That they thought this was such a big deal that they had to intervene to address it. It's much easier, I think, for us in Canada at least, to get social consensus around people not going hungry than it is for us to say, well, really, everyone should be able to afford a trip for their kid with their money for their kid to have the pizza lunch at school. We can debate that part, but I think the extraordinary outpouring support that we've seen in Canada for food banks reflects a very fundamental social value of ours, which is that we will not let people in our midst go hungry if we know that there's something we can do about it. And so I think, I'm not sure that we gain a lot with that next layer.
Okay, question here, then we move down here, back up here. Questions are building up. So.
I'm wrestling here with microphones, as Martin knows I do. Valerie, thanks for your presentation. I apologise for arriving late. Alan Halsworth, University of Portsmouth. I've been looking at Canada and food for about the last 40 years. What I see behind the big picture is similar trends. We've got working poor. We've seen income inequality in this country accelerate over the last 4 or 5 decades, as Canada has. Is there a light at the end of the tunnel? Because in that period, you've had Liberal governments, like the one possibly you've got now. Is Justin going to save the day?
Well, it's way too early to tell. I mean, what is positive is that already, there've been some positive things happen. The return of the long-form census, for example. I mean, there are things that Justin's done in his first couple of months that have been very good. But he is the leader of the Liberal Party, and the Liberals' history on social policy in Canada is not positive, right? The architecture that enabled the I think dramatic proliferation of food banks through the 80s and 90s, and the what I suspect, although we weren't measuring then, was a rise in food insecurity. That came from Liberals. They set in motion a whole lot of very fundamental cuts to social programs. So I mean, I have to say, as we got near the end of the election campaign and Justin Trudeau started to bring out some of the old men who had been the the leaders of the decimation of Canada's social safety net in the 90s, I started to think, oh, Justin, what are you doing with those men? Get rid of them. But so I don't know where we're going to play out. I mean, it has to be better in terms of there being more openness to dialogue. But I wouldn't take for granted that we've moved to a kinder and gentler society.
Thank you. Question here.
Thank you very much for an absolutely fascinating presentation, and the wealth of empirical evidence which you produce is indeed totally convincing in your argument. But the question that arises is, it being so convincing, why does it not convince the powers that be? And one aspect of your presentation I found absolutely fascinating, which is the focus and the detail you gave on Newfoundland and Labrador.
Yeah.
And there you see, you made a side remark, which was the fact that Newfoundland and Labrador benefited from oil, from the income of oil. Now, what seems to me an absolute reality is that under capitalism, it's relatively possible politically to redistribute in conditions of economic growth. In other words, the politics of pressure
Yes.
can have
Yes.
an impact
Yes.
when there's economic growth, because those who have do not mind losing a bit of their extra income to help the poor.
Yes.
But in conditions of crisis, that isn't politically possible. And that's not the reason why in crisis situations, it's the poor that suffer and the rich do not suffer in that sense. When you looked at the, you had another slide on Newfoundland and Labrador, which I found fascinating, which is the fact that a lot of these slides do show the situation getting worse after the 2009 economic crisis. But in Labrador, Newfoundland and Labrador, it seems to have only happened in 2012.
Yep.
I wonder whether that's a relationship to the price of oil rather than the nature of the capitalist crisis. In other words, in Newfoundland and Labrador, you may have had a situation where, because of the existence of oil, a bit like in Scotland, the redistribution is made possible. But in a situation of economic crisis, what you're arguing for is the effectiveness of public policy as against charity. And that's centrally an ideological argument. It's an argument in favor of state intervention against responsibility to the individual. And that's the reason why food banks are prioritized over state policy.
Okay.
It's because they actually blame the individual and give charity the answer.
Okay.
I'm sorry about that.
Okay, you've said so many things, I don't even know where to begin with you. Let me jump in right away, though, and say I would take issue with the assertion that my arguments about the effectiveness of social policy and the ineffectiveness of charity are ideological. I actually think it's an empirical argument. And I think we can speak more about what more evidence I would need to marshal to make that clear. But I think that first and foremost, it's an empirical argument. Going back to Newfoundland and Labrador, and you said rightly that they had an oil boom, they had an economic boom, so they were well placed to invest in social programs. There have been many, many examples in Canada over the time that we have been measuring food insecurity. We have many examples of provinces and federal governments in surplus positions who did not invest in the poor. As a matter of fact, this is probably the only example we've got of one that did. So the economic boom doesn't account for this, because if we take our richest province in Canada, or historically our richest province in Canada is Alberta, And they absolutely have not used their money to make the situation for their people any better. I mean, this is Alberta. They don't stand out as having a zero food insecurity rate or any sort of generosity in terms of their social programs. So money alone in the coffers of a government is not enough to bring on good social policy. And what Newfoundland and Labrador had that was special, I think, was a leader who was just very, very committed to Newfoundlanders. You know, at some point in the game, we have to recognize that 90% of what goes on is leadership. It's not evidence. It's not, you know, it's not money in or money out. I mean, the interesting thing about the Trudeau government right now is that they've campaigned on running a deficit as a way to sustain social programs, and that's, you know, again, it speaks to a belief system. I have not done justice to Rachel Loopstra's work on Newfoundland and Labrador, because the other points that you're raising about this change and how it paralleled economic climate in Newfoundland and Labrador, that is a question that Rachel did an extensive analysis of, and I just didn't include it for the sake of time here. So her analysis would say that that isn't the story, that only a small part of this reduction can be attributed to the economic gain, but that a very substantial amount of it can be attributed to changes in social policy that were perhaps enabled by that budget surplus, but that were about money being transferred to people who didn't join the oil patches or the oil fields at all, right, but who remained on social assistance, arguably people who would be the hardest to move. I know, I can see you just dying to come back and say, yes, but you've got it wrong again.
Well, it's just a point that I say that economic means is a necessary but not sufficient
Yes,
condition.
okay, we are at one on that. Yeah.
So they're in the politics. Where I would disagree is the question of leadership, as opposed to the question of a movement from below, which pushes the difference.
Yeah.
It's the movement from below that pushes the leaders to take different positions rather than the leadership itself. That would be my argument.
I'm not sure about that either.
Okay, well,
Okay,
leadership
more.
from below might be about food banks. That's the problem. That might be.
Okay, so I'm Lindy Sharp. I'm a doctoral student in the Centre for Food Policy here. My question is really about policy intervention. As I understand it, you say that the policy intervention that was effective was a poverty reduction policy intervention, not a food strategy.
No, that's
intervention.
yes, true. Yes,
So
true.
when,
That's true.
I mean, I find it very interesting, for example, that people then politically there were calls for a policy to, what was it called, to end nutrition and food insecurity. What sort of requests are in those strategies? How do you target the strategies to food when it actually is about income?
But we don't. We're saying that the problem is really income, and we're asking for policy to address the income. So no, I mean, you're right. It's a switch. But the preponderance of evidence that we have on food insecurity in Canada would say that one of the things that we need to do in our country to ward against this problem is to set an income floor below which we will not let people fall. And we don't have one of those now, right? So that we can have 2/3 of our food insecure population being made up of people in the workforce who are, you know, working in precarious jobs, and whatever social transfers we have for them are insufficient to bring them to a point where they have, you know, food security. And so, the beautiful thing about that Dietitians of Canada call for a national strategy to reduce food insecurity is, number one on that strategy is a basic income. So no, I realize that, and it kind of goes back to comments you were making, I realize that it's a slippery thing. We start with the word food and food insecurity, and then we say, but what we're really trapping here is material deprivation, and that's what we need to tackle, and part of tackling that is income security. And so let's go down that path. But I think we're getting there. I mean, that's absolutely what our knowledge translation activities are about now.
Thanks. Hi, Jeff Tansey. I chaired the Fabian Commission on Food and Poverty, which reported last year.
Yes.
I hope you've read it, Lynn.
I have read it.
Because I'd be interested in any comments and suggestions you have for how we can get movement here. But a couple of questions. One was about the right to food, and Olivia de Schutter's, or I gather, was rather unwelcome visit to Canada to have a look at what was going on. Because there is also a discussion about the issue about the right, using the right to food. And in Scotland, this is actually in the political debate. It's not so down here in England in the same way. And the other area is about the poverty premium. Do you have the same thing in Canada as we have here, that the poor pay more for all the basics, the utilities and food and so on? And that's one of the areas that we need movement to address.
I'm not sure. I mean, I found your discussion of the poverty premium in your report very interesting. And it's not something that we talk about in Canada. And if we were, I mean, most people in Canada who are food insecure are renting their accommodation, but most of them have utilities included in their rent. So, like, I don't even know if we were to try to take a basket of basic goods and services and ask that question, I actually don't know that we would find that to be a big issue. That I think for us the bigger issue, the thing that we certainly have better evidence on, is the income side of that story. So I'm not sure. I mean, logically it makes sense that if something costs more money, then you need more money to be able to purchase, to meet that cost. But I don't know that we have gigantic differences in terms of cost. I mean, we've tried to do some work looking at food, but it's very, very complicated because when we have, in 2010, this food security module was included on the survey of household spending. So for 1 year in Canada, we have very, very comprehensive data on household expenditures in conjunction with household food insecurity. And it's interesting looking at that, but it doesn't scream poverty premium, not at all. Okay, the other thing you mentioned was the right to food. And it's something that continues to be talked about. As you know, Graham Ritchie's is in our country, and he's a very strong spokesperson on that. I don't know how much political currency that concept has. It's not to criticize it, but whether it is sufficient to be a rallying cry, I'm not sure. And so, I mean, the visit by de Schutter, I think, was most important in what it did in terms of bringing together civil society around these issues and drawing some attention to the issues from their perspective. Politically, my sense is it was probably quite irrelevant.
Hi, I'm Anna Taylor from the Food Foundation. We're a small think tank working on food policy. Thank you so much for your presentation. It was really great. I'm really interested in asking you a little bit more about the comments that you made about when you started to publish the national data in a more sort of communications-focused way. And you talked about sort of being quite aggressive in trying to challenge the food bank figures, and that people have now all kind of come together a little bit more.
Yep.
I'm interested to know a little bit more about that process and to what extent the food bank community now are really calling for the sorts of things like the food insecurity strategy and so forth, and whether that really is a unified voice now, or I mean unified, in a broad sense, but have people come together around some of those policy asks?
I think a lot of people have come together around those policy asks. I don't know that we'll ever see a unified voice. Yeah, it's tough. It's only in the last few years that we've had this organization called Food Secure Canada, and it's an attempt at an umbrella organization of civil society actors in the food domain across a very, very broad range of issues. And one of the issues is food insecurity. And so they have 4 pillars, and one of them is zero hunger. And so that has helped a lot. They've convened national conferences, and I have participated in those things. And they held a panel discussion last year where so it was a huge gathering of civil society players, but with politicians invited, and me debating them on the topic of a guaranteed annual income as a response to this. But so there's a lot of potential, and I think all of those kinds of events are helping to educate people around the numbers and the facts and the figures, and helping people to be able to amass a case themselves for why we need policy intervention. The large food bank organization, Food Banks Canada, the umbrella organization, if you look at their policy recommendations, they're very similar to the kinds of recommendations that other groups would make. What unfortunately they also have recently put on the table is a call for corporate tax credits for donations to food banks. And I hope it doesn't go forward. It's disappointing to see it. But, as I said in the beginning, food banks have been a place to dispose of corporate waste from the beginning, right, by design. And so when you look at the board of directors of that food bank organization, it's major food companies sitting there. And they would stand to benefit from the tax credits that are being requested. So it's disappointing. It's a tension. I feel like we're in some ways at a crossroads, that if that ask goes forward, we really will have lost a lot of ground. However, we are able to, those of us who are concerned about that ask are able to come together now in a way that we never were before. And the fact that we have this astounding evidence on healthcare costs, and healthcare costs are a very big issue in Canada because provincial governments are trying to cut their budgets, and we're saying you've got a very large expenditure here that is because you have so many people in your province that are food insecure. So, I feel hopeful in some ways, but it's worrisome. No, we're not at one voice, and the most screaming example of us not speaking with one voice is that tax credit proposal on the table now. But I feel like if we may be able to use that as a way to really consolidate the movement on the other side.
Okay, question here, Mary.
Mary Atkinson from the Food Research Collaboration. Thanks very much for your talk, especially considering you just got off the plane.
Thank you.
I really appreciate that. You said right at the beginning that it took till 2005 until food insecurity was properly monitored in Canada. So that's 24 years after the first food
Yeah.
bank opened.
Yeah. Yeah.
So I just wanted to ask
Why?
you why it took so long, and whether there's any learning from that we can take here when we try to move that.
Well, I hope there is. In that sense, you are so much further ahead than we are. After this day, I am traveling to Scotland tomorrow to meet with people there to talk about measurement of food insecurity there. And so in preparation for this very quick trip, I have been doing some reading, and so I read the report that Jeff Tenzie mentioned. I also have read a number of reports related to food poverty and the measurement of food insecurity in Scotland. So I've been reading your literature, or at least as much of it as I could find time to read in preparation for this journey. And every one of the things that I have read, I've got to say, is humbling. We never, in the entire history of this story in Canada, we never had a report like this Fabian Commission report. Never. We couldn't have even filled a small coffee table with, or a small, we couldn't have had 4 people over for dinner who would have spoken in the way that report speaks. Like, we never had that. The report that I read from Scotland on food poverty there, like, nobody in Canada was ever commissioned to write those kinds of reports. So in that sense, you've got the big picture mapped brilliantly and with very, very striking recommendations. I passed your report to colleagues in my office after I read it to say, look at the way he's writing about minimum income. Think about this. Look at how they're talking about work and income here. Like, this is brilliant. They're clarifying why it's not just minimum wage. Like, we have to, take that text, for God's sakes, but we didn't have that. And so I feel like, yes, okay, it's 2016 when you've got all of this richness of, so you've got this big conceptual framework put together for you. When we were muddling along through the 1990s with these hunger counts and with these silly little indicator questions, just scattered in random fashion across surveys with no relationship from one to the other, we didn't have anybody convening a big meeting of, the thinkers in Canada to talk about what to do about this. We didn't at all. And I don't know why we didn't. I need to reflect on that. But I have to say, it's been really humbling to read the literature that I've read, just mostly the reports, right? So I feel like in that sense, you are much further along. I can see moving through all of that. Is it okay if I keep talking?
Yeah, keep going. Then we're moving into
some
Okay.
questions up here.
Okay.
so I'm just
Okay.
moving
Well,
across.
one of the things that I can see in reading these things is we are very strongly now speaking about food insecurity as material deprivation, and the responses need to be income-based. What I can see in the stuff that I've read, and it's what I would expect in the context of no food insecurity measurement, that the language of food has taken you into looking at dietary intakes and at food retail access. And so there's a lot of that in the reports that I've read, right? People looking at food costs, food costing studies, food retail access, all that kind of stuff. It took until we had measurements for us to start to have that fade away and realize that that actually wasn't very important. That food expenditures per se are a very, very weak predictor of household food insecurity. They drop off the page as soon as you put housing expenditures on the table. Food retail access, we found, is a trivial component. That what's really important is how much money you've got in your purse, not whether you have to walk 1 block or 5 blocks. And so, like, there are things like that that are the nutrition components. Yes, we can see differences in the dietary intakes of food insecure and food secure Canadians, but they're trivial differences compared to the differences I showed you on healthcare costs. So, you know, I can see that at this stage, one of the things that strikes me about the reports is this real strong presence of food issues and the way in which food insecurity, the obesity. There's a lot of talk, it seems like, about the relationship between food insecurity and obesity. And so, forgive me for going on like this, but you have to understand, I had a rather late night. And so I'm a free thinker at this stage in the day, shall we say. So I am struck by what seems like a conflation of this problem of, a very serious problem of people struggling to afford the food that they need. And then these bigger ideas about nutrition and health and well-being that have been around for a long time, right? The problems of food quality and food quantity and convenience foods and food processing and all that, obesity, diet-related chronic illness. I can see all of that coming together in some of these reports in a way that I feel like if you had measurement, you would start to pull apart. Because in Canada, it's like once we started to look at the numbers, like those things are not where the action is. That's why it's been so easy for us to say, you know, we've got to talk about income. This isn't about food retail access. That's a different issue. That's for someone else.
Okay, we've got about 4 questions in about 10
I'll
minutes.
try to be shorter.
No, I'm not asking questions short, not answers short.
Hi, my name is Lynn Davis. I'm a member of the Land Workers Alliance in the UK, which is a union of small-scale food producers. And we, at the moment, are working with the food sovereignty movement in the UK and other organizations to develop a people's food policy, which is heavily inspired by the Canadian people's food policy. And we found that quite inspiring because of the extent of the participation in that process, 3,500 people, etc. I was wondering if you could share some insights on the efficacy of such a process.
Really not. Really not. I mean, my involvement in the process was only as it related to the food insecurity component, and I actually didn't see it as a particularly important process.
Talk to me. The Australians are doing something similar. So
Yeah.
I'm in Melbourne, and we're in contact with them. Question here, then from two.
Hi, Laura Hamilton from the Thomas Coram Research Unit at the Institute of Education, UCL. So just 2 very short, quick questions. Firstly, I just wondered how the food bank system worked in Canada. Apologies if you've actually already said this, but is it similar to here in that you need to get some level, so you need to go and ask your GP or social services or something? You don't have to, you can just sort of
It depends on the place, but typically not, yeah.
Okay, and is it the same in terms of you only get 3 days worth of emergency provision, or again, is it not similar?
Well, they might say that. There might be policies stated about 3 days or 5 days, or you can only come once a month, or you can come, you know, once a week if you're on welfare, but once a month if you're not on welfare, or once every 6 months if you live in Medicine Hat, or once in whatever. Like, there are all kinds of rules like that. We did a study a few years back where we actually put researchers into food banks in Southern Ontario to see what was going on. That was very illuminating. And so I would say that unless the system in England is very regimented, I would question whether any of those things that you're describing are being realized. We actually at one point had students going into food banks and weighing and measuring the food that was given out. We found people receiving, in a very large system that was very well established, where the policy was 3 days worth of food, we found people receiving anything from less than half a day's worth of food to 2 weeks worth of food. And that was within the period of a few days of data collection. What made the difference? Well, some of it was supply, some of it was who was asking, some of it was who was giving. There was a lot, right? This is a very human system without any checks and balances, at least in Canada. So I would be really skeptical. I mean, one thing that is very common in Canada is that food banks will report running out of food or having to ration, having to diminish the amount of food that they give out. I mean, it's a donor-driven system. And I don't know if that's different here, but in Canada, it is a donor-driven system. So they can only give what they can get. And that defines both the quality and the quantity, but it also means that the supply is always out of their control. And if they let more people through the door, they have no choice but to diminish how much they give away. What do they end up doing then? They close the door so that they won't have the horrible experience of saying, no, you can't have any, right? They'd rather not face the people they're going to turn away. So they just close the door, or they put in rules to say, no, we won't take you if you've got an income above this, or if you can't show proof of your children's father's residence or something. So there are many ways in which they have no choice. Because demand always outstrips to supply, there have to be rules put in place. But I would be really, really skeptical. When you hear things like the 3 days and the 5 and the referrals and all that, you get the feeling of a very rational system. But if it's an unfunded system run by volunteers and reliant on donations, it can't possibly be running in the same way as whatever your welfare programs are run.
I mean, I think that's all the UK data that's appearing is suggesting exactly the same. It's a human face. People say, well, we do give more than 3, but we shut down because we can't have food. There is an emerging database on this coming as we speak. There's more and more being published. But the public face for the food banks it's about deserving and undeserving poor. So they say we only give 3 days because, and you can argue the same about the group to social supermarkets. That the membership is limited for exactly those donation reasons, that they're targeting the donors, not actually the users.
Yeah.
So, thank you very much. My name is Sergio Schneider. I'm from Brazil. I'm academic visitor here in this university with the group of CFP. So, your presentation contrasting very much, and I would say they are absolutely antipode from the data that you're showing. My question is about what you suggest in terms of a gap in knowledge to send message, because there is a literature available in journals about the Toronto Food Council, for instance. What the food councils have been done in Canada about this issue, about this topic of food security, because I wonder that things should be better in terms of what I read in the articles and what your data are showing.
Well, the local food councils really can't do anything about this issue, right? It's not a food problem, and it's not about anything to do with the organization of the local food system. So, no, I would say not at all. I actually think this problem, if there's any relationship to the food system, it's perhaps related to the nature of employment in the food system and the way in which the workforce, the design of the workforce in our food retail and food manufacturing sectors, but particularly food retail, lend itself towards precarious work. But no, I don't think this is a food systems issue at all. And I think that if we now were to line up all these local food policy council actors, they would say the same thing, that they can talk about food retail, or the spatial arrangement of food retail, or the presence of food in schools or whatever, but they have no jurisdiction over things like income or affordable housing or employment, the arrangements of employment. They have no power over those things. So I think that it was naive to think that local food policy councils would somehow be players in this scene. Where they've started, where I hope we will start to see local food policy people rise to the fore, is now one of the things that's very interesting about the Food Banks Canada proposal for corporate tax credits for donations, is that they're moving their policy proposal through municipal councils in Canada to try to get the Federation of Canadian Municipalities to make a recommendation to the federal government for federal tax credits. And the resistance, therefore, has to happen at a municipal level. And the leaders, some of the leaders that are emerging for the resistance side of this are Food Policy Council people. So, there is a way in which it's coming together now. But no, I can see that you don't agree with me, but no, I would say that the reason our local food policy councils have not been more effective is because the things that drive food insecurity in Canada are outside their bailiwick.
I mean, and Toronto's unusual. Toronto's one of the ones that got some powers, unlike lots of the other food policy councils.
Not with respect to food insecurity. Yeah.
Well, I mean, the argument is it's based on the old GLC model, and anything that's got to do, they technically could make comment on. I don't think they choose to. It's the public health law. I mean, I think they're a bulwark, but they're not the solution.
Hi, I'm Claire Mahos from the Centre for Food Policy here at City. It's mostly a point of clarification. You had very striking data about the correlation between food insecurity and healthcare expenditure.
Yeah.
Was that only government funded health expenditure, not private?
Yes.
So there's people who are
That's
food
right.
secure are accessing private healthcare.
There wouldn't be that much private health care. We have, there wouldn't be, I mean, in Ontario, there wouldn't be that much. What is not shown here is the prescription drug costs that would be borne through employee programs or through private programs that we could expect to be more common amongst the food secure. But so this is the public purse outlay of monies, not the totality of costs that anyone would incur.
For example, you mentioned that people on social welfare would get prescription drugs funded and not.
Yeah, but that's the only one of these bars. This pale blue one is the only part of this graph that would have any means testing associated with it. And there's been an awful lot of work happen in Canada to resist the creation of private healthcare facilities. So if someone needed to go to have surgery for something, they would go to a hospital, and whether they were food secure or food insecure, it would be the same place, and it would probably be the same people doing the surgery.
Okay, great. So having clarified that, that's very striking data. So have you found it useful in terms of campaigning work or convincing governments that they need to do something because they're going to, as you said, they're going to make money?
In the long term, not tomorrow.
Thank you.
I mean, the problem it's a classic public health problem. This is not a saving tomorrow. This is a saving at best in 10 years' time. And governments may not be in power in 10 years. I mean, let's be cynical. I'm cynical about this. They're not going to invest in something that costs today with benefits. They're less likely.
What has been useful about this is it's been, for me, a way to engage the medical community in Canada. And they have a huge amount of political and social capital. They've typically talked about social determinants of health and poverty, and we know all about that. And they've taken very little interest in food insecurity, or if they have, the materials that they've written have been very naive. We published this in the Canadian Medical Association Journal for exactly that reason. And it's interesting, they created a commentary to go with it. They invited people to do a commentary. And it was interesting to see what they wrote in the commentary. It's a very confused piece of writing that ruminates about the causal pathway. But it's, it's the beginnings of that community engaging in this reality. And, I can tell you that if we were to make the same graph, which we could do with these data, for something like income or education or the tobacco, food insecurity looks pretty powerful in relationship to those other classics. So I think we are getting their attention in a way that we've not seen before. What's also helpful for us is that our arguments around the need for a basic income are compatible with the more kind of socially progressive end of the medical community in Canada that is arguing also for a basic income. So we're coming together in terms of the ask in a way that we hadn't anticipated, but that's probably our biggest thing. It's not like, when we publish this, it's not like the Ontario government was on the phone saying, Valerie, I want to talk to you.
Okay, we have time's up. We have to end it there. I'm sure this conversation is not actually over by any means. I have to say, Valerie's piece, was it in Toronto, in the newspaper about the tax breaks, was a classic piece of work.
Thank you.
Google it and look at it. It's just a wonderful response about letting the corporate sector off the hook. So
outrageous.
Can I say, on your behalf, thank you to Valerie. Can you put your hands together again?
Thank you.